we
Good
got
evening. Yeah. Good evening, everyone. Welcome.
good evening, everybody. We have such a good topic tonight and such a robust panel. Oh, A+ panel tonight, Erin. I'm very
Definitely.
excited about this one.
Yep. It's a great way to kick off October. And I can tell all of the interest by all of you that have joined already. So we are excited to host this
Hmm.
panel, this discussion, and this space to have this conversation on such an important topic. So, what a speaker series we have to look forward to.
Yeah, so a little bit of a quick introductions for those of you that don't know us. My name is Sue Weldon. I'm the founder and CEO of Unite for Her. I'm here with my lovely colleague, Erin Pellegrin, who is our Senior Director of Education and our registered dietitian team. So we are always honored to come into your living room or your home 3 times a month, Erin. Our library is so robust now. So many incredible topics, and a lot of them have come from our community. So please keep bringing them our way. Even tonight's topic came from our community, which we're going to start with that lovely woman who really asked us to bring this front and center. And of course, she had me right at the beginning, right at the beginning. So the topic for tonight is the choice to stay flat, medical insights and patient perspectives after breast cancer. But before we get started, Erin, I think we ought to thank our sponsors because we can do what we do without them.
You got it. And just like Sue said, we have a really robust education library. So not only tonight's segment, but we've covered lots of different discussions. So we encourage you to check out our library, but we could not continue to bring these segments to you without the support of our education sponsors. So our virtual education events this evening are presented through UFH Connect by West, Merck, Lilly, Novartis, and Gilead Sciences. We have support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, plus additional support from AbbVie, Tercera Therapeutics, and Veristem Oncology. So they are continuing to support our ongoing initiative. And like Sue said, we have an ongoing motivation to continue to bring you important discussions, important topics, and the very best experts in all of those fields.
Yeah, October's full. October is
Very.
full. Yeah, how about if we run down a couple of our reminders, Erin?
Absolutely, because we're just kicking off the month tonight. So, this is actually our first of two education segments that we have. So, hopefully, you will join us on Wednesday. We have our virtual hangout that'll be taking place at 5 p.m. Eastern Time, also on Zoom, just like tonight. And our topic will be keeping your crown, hair preservation strategies during cancer treatment. We will have a representative from Paxman Scalp Cooling System, as well as a representative from the Cold Capping Partners of America. So we will be learning about the different strategies to preserve your hair and how you can bring those technologies into your oncology center because they are available across the country. So if you're not able to join us, that will be recorded and available in our library. Plus, next week, we will be joined once again by one of our expert panelists this evening. Our speaker series next Thursday, October 16th at 6 p.m., will be a shared journey, surgical insights, and patient perspectives on male breast cancer. So we'll be joined by Dr. Susanna Nazarian, who'll be on our expert panel tonight, and one of our own Unite for Her members sharing his experience and insights with his breast cancer diagnosis. So as always, you can register and view all of our video libraries at uniteforher.org/UFH Connect.
Perfect. And I'll pop that in the chat for everybody as well so they can go to our library, search topics. You can do that by all different types of speaker series, Ask the Experts, virtual hangout topics that we've covered already. And they are still holding strong. We do an inventory of our library every year to make sure that all of the information is up to date. And it is, and just so happy to have such an incredible team of advisors and presenters that come our way. So thank you. And tonight is no exception. Tonight is no exception.
Absolutely. Not at all.
A little bit of just a little housekeeping, right, Erin? Just for those of
Sure.
you that might forget, right? We have a big audience tonight, so just keep yourself on mute if you could, just so that we don't have the background noise. If we hear it, we will probably mute you, so don't take it personally. We're just going to go in and get you on silent, and then any questions that you have, pop it in the chat because we will have probably an interactive discussion. I'm assuming, Erin, I feel like it leads to that kind of Q&A, even though we have people presenting. Feel free to put your questions in the chat, and Erin and I will talk to our panelists because we have such an incredible panel tonight. This topic to me is just very close to my heart because I did choose to be flat for the first 4.5 years. It's difficult decisions for so many reasons, and I know that being able to hear all those different perspectives tonight, there's no right or wrong reason. Whatever you feel is good for you is the right reason, and I can't say that enough. It just 21 years ago, that wasn't a case. It was a little unheard of that I decided to stay flat. And yeah, and it was a little, I would say a little traumatic for me, right? To see that reaction to my decision, but I was in such, denial and did not care. I just wanted to make sure that I was able to get through my treatment, that I really blocked it all out. And I am so happy to see that our women today still probably facing some of the same feelings, but so many of them are embracing being flat. They're getting tattooed and are so proud and feel so good in the skin that they are in. And that's where we want to be. That's where we want to be. So we're going to go through all different types of options and feelings, and how we ended up in this topic tonight, because there is a great deal to learn about the surgical options, emotionally and physically, that we all go through. All right, Erin,
Wonderful.
shall we bring on our guest?
Let's do it. Yep. So I'll introduce our first couple panelists. Now, I will say Dr. Nazarian will be joining us from the OR, but it is my honor to introduce her because she truly is incredible in this space. So if you're not familiar, Dr. Susanna Nazarian is an associate professor of surgery in the Department of Breast Surgery at the Sidney Kimmel Cancer Center at Thomas Jefferson University Hospital here in Philadelphia. She received her medical degree from Johns Hopkins University School of Medicine and has been in practice for more than 20 years. Dr. Nazarian has expertise in treating mastectomy, breast reconstruction, among many other conditions. We also are joined by Stacy Kahan this evening, who will be sharing her own personal experience. So she's worked in the pharmaceutical industry for 20 years, specializing in managing clinical trials in immunology. In 2020, at the age of 45, she was diagnosed with stage 1 invasive ductal carcinoma, ERPR positive, HER2 negative, with no lymph node involvement. After a double mastectomy and delayed deep flap reconstruction, complications led to left-sided failure and a flat closure, while the right side healed successfully. Currently, Stacy's undergoing tamoxifen treatment for her next decade, and she shares her story to inspire others, emphasizing resilience, empowerment, and a love for life.
Yeah, thank you, Erin. And I have the pleasure of bringing on Dr. Pelia Friedman, who has more than 25 years of experience for providing individual, couple, and sex therapy. She is an associate professor at the Center of Human Sexual Studies at Widener University. She's also a relationship and sex therapist at Rittenhouse Relationship and Sexual Health, plus has served as a sexual health consultant and provider and advisor for Unite for Her since 2015. Dr. Friedman, thank you so much for being here. We so enjoy having you as a part of our panel. And then we also have our dear friend Dana. Dana is Free, has been a part of the Unite for Her community for a long time now. Dana, thank you for joining us. I know you were diagnosed in your 20s, founded Ana Ono, thank goodness, out of your own necessity and desire for not only beautiful but comfortable lingerie that fit your surgically altered body. After mastectomy with reconstruction, traditional bras no longer fit. I definitely can attest to that. Dana knows that. And Dana was certain that there must be more than just sports bras and camisoles out there. With a degree in fashion design from Savannah College of Art and Design and a quite a successful fashion industry career. She took her decade-plus product experience and put it towards designing and launching and building Anna Ono Intimates design differently as we know it today. So please join us in welcoming our panel tonight. Yeah, thank you all.
Thanks for being here.
Yeah. So we felt like, Erin, we wanted to start with Stacy because Stacy was really someone who brought this topic front and center for us. We were actually here in the office and got to talking about just what happened with Stacy's surgery and how she was flat on one side. But her experience is a little different, right? Hers was not by choice, mine was by choice. So, Stacy, I really wanted you to share your story tonight for everyone, and you can kick us off.
Thanks, Sue. Thanks, Erin. Thanks, everybody. Hi. Um, as Erin said, my name is Stacy Kahn. I was diagnosed in 2020 with stage 1 breast cancer. I knew that I did not want implants. I knew that my body would probably reject them. So I had found out about DIEP flap, and that was the way that I wanted to go. I researched surgeons, and I had a double mastectomy and a delayed DIEP flap reconstruction. Unfortunately, I had 3 surgeries in 3 days, and on the third day, I was told that my left side was not viable and I would be flat closed, and I was devastated, to say the least. I asked if they could put an expander in, and so that I could think about what I could possibly do after. And I was told, nope, we just need to close you up. We'll leave some extra skin, and we'll talk later. I left the hospital a day later, and I was mortified. It was not what I had set out to do. I had one side reconstructed, one side flat. I thought maybe I should just take the right side off, but I didn't. I was petrified to go under the knife. To this day, 5 years later, I don't know that I'm ready to go under the knife. And so within a week, I was at a local shop that some of you probably are familiar with, JN Intimates, with my drains in tow, bandages on, saying, help me, I need a prosthetic. I wasn't going anywhere. It was pandemic time. I was, sick, but the way that our society makes it seem as if you need to have breasts to be a woman, is where I was sitting in that time, in that space. Thankfully, they were lovely, and they got me some prosthetics. They introduced me to to Anna Ono and all of her lovely products. I settled in with prosthetic, and I have stayed with a prosthetic since then. I've stayed flat on the left side. But it took a long time. It was a very difficult time for me. I had doctors saying, look, what do you want to do? Let's get you back under the knife. We can do this. We can, tram flap. We can do an implant with fat grafting, and, we'll make you look beautiful and normal. And those words to me it's your own personal choice what makes you feel beautiful and normal. And for me, that's having one side reconstructed, one side flat. I wear a prosthetic. I've named her Phyllis, and I just have to make light of it. And it's taken me some time, but I am now very comfortable in my own skin. And I approached Dana initially, and then I reached out to Sue and her team to say that there's a missed opportunity for messaging here. Whether you're thinking of just going flat, whether you're in a situation like myself where it's, you don't have a choice necessarily, it's not about just making you look beautiful, whatever that is. It's whatever it is to you, whatever makes you feel comfortable. And I want women to know that there are so many options, and that deciding to go flat is one. And since my diagnosis, of course, being in the community, you get connected with more and more people. I have since had a couple of other acquaintances that I know and friends, and they actually chose to immediately go flat. One woman reached out to me and we had a conversation, and she decided after talking to me that she didn't want to consider any sort of reconstruction and really felt more comfortable going flat. So that's my story. That's where I come from and why I felt that this is an important message. And that I hope that we can have a bigger conversation and let people know that beautiful comes from within. It's it's what you make of it. It doesn't have to be any sort of reconstruction or anything else. And so yeah, so thank you for having me. I appreciate it. And I look forward to hearing the other panelists speak as well.
Yeah, thank you, Stacy. I think a lot of people are going to resonate with what you said. I know I do. I I can't get over the let me fix you, let me make you beautiful again. It's like, okay, right? Like there's so much more there than just our breast. And to have that confidence and for us to tell those stories just gives other people agency. So I appreciate you so much for coming out and sharing where you are. And please jump in. I know the chat will probably be very active tonight with personal stories as well and feelings. And we're all here just, a beautiful area of confidentiality that we can just speak to and have these honest conversations. So thank you, Stacy. We appreciate you.
Of course.
Yeah. All right, Erin, shall we bring on Dr. Pelia Friedman?
Absolutely. And I think she brings such a great perspective to this discussion as well, because certainly, you know, in the same realm that we talk about when we're losing our hair or a physical aspect of us changes, this is certainly that physical aspect as well. And so that body structure changes and how we sort of move through the world and others' reactions. So you mentioned that earlier, others' reactions to your decision. So I think the conversation from Sabitha just around managing all of that and the emotional shifts that happen and how to work through all that is a really important discussion, just as the medical discussion to come to that decision as well. So we're really thankful to have you here giving us that perspective.
Thank you. I just turned on my timer. So I'm delighted to be here. So I have two different journeys that I can bring together here. Part of my journey is that I was diagnosed with breast cancer in September 2009, and I had a double mastectomy and a reconstruction, transplant surgery in October 2009. So one of the things, that when I heard you speak, Stacy, is that we were not given an option. I did not get an option. I remember sitting at the surgeon's office. He said I could have a lumpectomy, or I could have a mastectomy and a reconstruction. I could have implants, and then I could have, transplant surgery. Those were the options that were presented to me. So I experienced I've been researching a lot since I was asked to speak here about going flat. And so I think I experienced what's called flat denial. That is not being offered the option that you could go flat, and it is, it's an option. So I didn't have that option. And I think one of the things that I experienced also as a patient was that I was a 34C, and for some reason I told my surgeon, I just want to stay this way. I don't want anything to change. I just want to look this way. um, uh, they made me a 38D, and the surgeon thought that he was doing me a favor or something. He talked to my husband about it. My husband's like, I don't really care. He's not even a breast man. So I'm like, why? So it was, so I carry this with me, which is kind of a huge kind of sense of like my body changed in a way that I didn't want it to change. And so, so I think, among other things, this is a trauma as well. Sometimes when your healthcare professionals do not listen to you. So when I was doing my research on going flat, and reading about satisfaction, one of the things that came up to me that was very exciting was that surgeon support predicted higher satisfaction among people who go flat. So I'm thrilled that you have a surgeon who's going to come and speak about it, because so finding healthcare providers who can support you during this decision is so important. And if you want, I can give you the research that I found. This is from 2021. It's a more recent research, and I can certainly, send that along so you can post it on the website for other people to look at. So on an individual level, I was thinking about, what are some of the, important areas to think about when you're going flat. Going flat and getting reconstruction, they all have a common component, which is that you're doing that after mastectomy, or or double or single mastectomy. So you're losing part of your body. And so one of the things to consider is that you're going to experience a sense of loss, that what you had before, the way you experienced your body, the way the sensual nature of your body has changed and has been altered, which does not mean that you will not be able to be sexual. It just means you will have to embrace your new body, accept it with self-compassion, and invent new ways to be sexual. There are many, many ways to be sexual, but it takes a little bit of adjustment. But it's really important to think about the fact that the loss is an inevitable part of the journey. So to experience a loss, to work with a therapist if possible, or to, journal, whatever is your way of dealing with the loss and your sadness about the body that has been altered. That is a very important first step. And the second step is embracing your new body, because it is yours. You're healthy. You're now in this new stage in life. So accept your new body with affection and kindness. So this is a very important step towards then being, exploring this body with your partner. So you yourself need to say, pleasure it, eroticize it before you offer it in a relationship. So in a partnered relationship, I mean, of course, please ask me any number of questions, and I'm glad to offer you responses. Because of the 15-minute timeline, I'm keeping it short, but I really would I can expand on anything that I'm talking about right now. And I think one of the losses that some of the I read a lot about people who have who have participated in the research. They were talking about was the loss of fitting into the societal norms, not kind of keeping up with the male gaze, who as to what a female body should look like. And right before the presentation, we were talking about how liberating it is to see these younger people who now don't care about that male gaze, that the female form as it is traditionally viewed is no longer viewed that way, that you could be gender non-conforming. You could, a lot of, women actually are binding because they don't want to conform to the male gaze. So that freedom is now being offered to us. So so this is something for us all to think about. Do we really conform to this restrictive, conservative male gaze and female gaze? Because society, we are judged as much the same way by, other women as well. So to think, is there a non-binary way of thinking about our bodies, that our bodies can be sexual, with or without a breast? That is something to think about. In a partnered relationship, it is really important to talk about the decision with your partner. I would highly recommend working with a therapist if possible, because, it's not to kind of pushing for my own services, but I really think it's important for someone to objectively speak to both of you separately. So when I work with couples, I see them together, and then I see them, separately, each person by themselves, to find out how they feel about the decision. Because sometimes, um, you know, th- two people may have a hard time talking about their honest opinions about things. So that could be helpful. If you don't want to work with a therapist, at least, have honest conversations. And, if there's an objective person who can help you with that decision, that's even better. That's also a good option. But, um, making the decision with a lot of communication, because there are two people in this relationship and this decision should be made together. And then navigating the adjustment phase, after the surgery, what do you want? Do you want your partner to look at your body? We have choices. We can choose not to, be naked before our partner. We can choose to be touched a certain way or not to be touched at all, or say, I'm taking a 2-month break from touch because I'm not ready. I need to first figure out how I feel about my body and how I, feel about being seen. So I'm going to take a 2-month break. So can we just be, partners without sexual connection? We could talk, we could hug, we could cuddle, but I'm not ready for anything else. I give people permission to do that because this is something we should be able to do at any stage in our life. After pregnancy, after birth of a child, after cancer treatment, after surgery, we should be able to kind of be within ourselves and to kind of learn how we want to move forward, and not to immediately push ourselves into places where we're uncomfortable, which would lead to trauma, and we don't want that. So I usually say, please talk about that and communicate your needs and desires. This is what I want. This is what I do not want. Since you've already had the discussion before the surgery, this should be an easier conversation to have. Now, you may ask me, what about when I'm single and I'm dating? Remember that this is something that you may have to approach from a very empowered place. Like, this is my body, and I'm going into the dating world with this body, and there are people who will love it and want it, and there are people who will not want it. In every dating experience, there are rejections. So we really cannot, doubt ourselves and think, oh, I'm not going to be accepted in a dating relationship because of this. It could be because of any number of reasons. So you will need to really, so in a dating relationship, first of all, talk about all your wonderful qualities, present yourself in any way you want in the profile, and hope we meet people who appreciate our bodies, because this is what we are bringing into this relationship. And it's also possible to meet a partner who loves flatness, because as I mentioned, we are living in a world where non-binary looks are considered attractive and cool. So it is possible to find people who appreciate non-binary bodies. So go in with, you can attract people who are non-binary, or who are attracted to non-binary bodies. So these options exist. So just to kind of summarize what I said so far, when you make the decision, communicate with your partner, and you be sure about the decision that you're making. And secondly, make sure that you find time with your body to embrace the newness of the body, to kind of embrace it and find pleasure in it, and find time to experience the loss. Because if you do not experience a loss and you keep moving on, that is not healthy. You really need to grieve the loss and then pleasure the body, because those two stages are definitely necessary. And then discussing with your partner what you like and do not like, and and become sexual, and being sexual. This is something I talk about all the time. Sex doesn't have to be, it's a particular way. It can be any way you want it. You can define your sexuality, your sexual activity any way you want it. And you can choose not to involve the breast. You can choose to involve other parts of the body. One thing that the the conservative, the traditional penile vaginal sex model, one thing that it leaves out is the sensuality of the rest of our bodies, right? Our bodies are sensual in so many different ways, and we don't always allow our bodies to experience, the sensation of the rest of our body. So this may provide the opportunity to do that. I know I'm out of time, but please ask questions, and I'm glad to answer any questions. Thank you.
Yeah, thank you. Thank you, Sabitha. I just wanted to comment because I had seen in the chat, and I was very much the same as what Kim had talked about. And I think you were saying that as well. We're not asking for permission from our spouses to tell us, what kind of surgery we're going to get done. Because I was 100%, I'm staying flat, not your decision. I will let you know my decision. And that's what I did. And he supported me 100%. But that communication is so key because they go, I think of our partners, and I do think of that. I did not involve him at all. And and a part of me just goes back and thinks, oh, I wasn't tuned into the loss he had to. Not of my body. I'm not talking about my body, just the trauma that we were all going through as a family, right? So, and I know when you were speaking about, discuss with your partner, it's not a decision. I know you. It's not a decision that you're saying you're making, like, and see if he's okay with it. It was more of a communicate, make your decision, feel good about what you want for your body. And I don't want to speak for you, but I saw that.
No, I absolutely. No, I absolutely understand what you mean. And, when I talk about communicating, I don't mean getting permission. So I just want to clarify that. I don't mean getting permission. I mean
Exactly.
talking about it, because if you have a partner, then you have that source of support. So they can support you through this process. So communication brings them closer to you. Whoops. Communication brings them closer to you, and then they are there to offer you the support. So that's what I meant. I did not mean getting permission.
No, I knew that. I did know that.
Thank you. Thank you for clarifying that. And thank you for reading the chat, because I wasn't reading the chat. I didn't know what was going on.
No, it's good. It's difficult. It's just everybody's different. And even I hear what works for one person might not work for somebody else, right? So you have to know,
Yes.
your relationship best, and you're the one that's going to be, leading that relationship. I know that we want to introduce Dana next, and I have to tell you, I feel like, Dana, you've been trailblazing, just being able to be who you are, showcasing beautiful bodies, showcasing one breast, no breast, two breasts, tattooed breast, no breast with tattoos. I've been seeing you do this for years, and I am so grateful for it because like I said, it just allows for the conversation to be more normalized and see the beauty in whatever decision you make. And I appreciate everything that you brought to our breast cancer community, because they feel empowered. They feel empowered because of your initiative and fashion and ability to put it out there, right? So Dana, thank you for joining us tonight. And I want to open it up and welcome you to the conversation.
Thank you, Sue. I could listen to everybody for hours. I think, there's so much here to unpack, and I just want to appreciate you all for welcoming me into this space. I was diagnosed when I was 27 years old, 15 years ago, and a little bit of a different story. Sometimes I think it's the time of diagnosis, but sometimes I also think it's where you're diagnosed. And I was diagnosed in Denver, Colorado. And the first option I was given was what they sort of said was to do nothing at all. So my first choice was to just remove my breasts and stay flat. And then the secondary choice was to reconstruct if I wanted to, or potentially preserve or save a breast if I wanted to. And I think you know, these stories are so different. And 15 years ago, these conversations were also very different. And to honor our dear Dr. Friedman, who threw out a few stats, just in the simplest of terms, you know, figure there's about 300,000 women a year that are diagnosed with breast cancer. It's a little less, it's a little bit more, you know, we're not 100% sure, but that's what we have documented. And for about the last decade, nearly 100,000 of those women undergo a mastectomy surgery, either on one side or both. About 100,000 of those women will preserve their breast tissue and have a lumpectomy, and about 100,000 of them will choose to reconstruct. So I sort of share that because I think it really normalizes all choices and all decisions that a patient can make. Because I think what you have to decide for yourself is something that's going to be right, not just for you physically, but also what's right for you and the pathway through your cancer treatment. I opted to remove both of my breasts. I did, in full transparency, undergo implant reconstruction. Maybe it was because I was 27 years old and I had a strapless wedding dress, and the only thing that made sense in that small little immature brain I had was to put boobs where boobs once were and just go on about my life and try not to be too disruptive. But what I did do throughout the reconstructive process was I was one of the first documented mastectomy tattoos around my body. And that to me was the moment that I took my life back and my treatment and my choices back. At that point in time, the only mastectomy tattoo on the internet was a flat woman with a Celtic vest tattooed up around her neck and on her collarbone. And she really talked about people paving the road for the future. She really is a miraculous woman that showed that there was more choices than to just undergo and do what your doctors tell you to do. So as a part of who I am, and maybe it was a nature of being so young and being in circles of other young breast cancer patients that were making bodily choices either because they wanted to or because maybe they were rebellious enough to not fall into the norms, or maybe they were losing their reconstructions. I've seen in the chat quite a few people that have struggled with reconstructive surgery. I can tell you that the option to explant is up. There's about 25 to 30,000 women a year that are choosing to explant from their surgeries. I also meet women that are choosing to explant from their flap surgeries. That is also an option, and it is not one that is widely discussed or talked about. And there's a lot of reasons for that. We can get into that in another session, but I always say that because the options are always on the table for us as patients. You know, you might choose to reconstruct and realize it's not what you wanted in your body and you want to explant. You can also be flat and reconstruct later like Sue did. You know, I think everybody has a very unique experience. Stacy is one of the patients that had a complication and lost part of her reconstruction. And these are very severe, very serious surgeries. And I think what I've just really strive to do is make sure that there is a representation of all choices available to people that are diagnosed with breast cancer, because it is so personal. And sometimes you have the choice and sometimes you don't have the choice as well. And it's really important to embrace it even when it might not be what you wanted. I think it's a very real feeling. And at Ana Ono, we say, you know, chest inclusive. So Stacy has modeled our one boob bra that's designed. I know that we had some slides, but I don't know if
We'll pop them up.
Erin, we can give a little visuals.
Yeah.
But I do think what's something that we do that's beyond just a bra. I do hope that newly diagnosed or people making new surgery decisions can come to Ana Ono. And we have a place where we say shop your chest type. And in those chest types, you can really see all of the different styles and all of the different options on people with different surgical outcomes. So if you only have one boob, you know, you might want to support that natural breast tissue or a failed reconstruction and be able to give yourself something soft and gentle against your scar or against your body that can protect you underneath your clothing. but also give you support to your natural breast. We've heard, many identifiers here: uniboob, unicorn, unilateral mastectomy, but it's a beautiful way to still honor your natural body while also treating your disease and cancer. And then, of course, Erin, if you don't mind flipping to the next one, we have aesthetic flat closure. And we have been talking about aesthetic flat closure for the 11 years that I've created Ana Ono, and well before, because I can tell you one of my first and most impactful experiences that got shared with me was a woman that had sent me an email about how her dream was for her husband to unhook a sexy black lace bra off of her body, although she didn't have any breasts. And when she shared that story with me very early on, it allowed me to see into the world that our breasts aren't what define us. The way we want to express ourselves and who we want to be as people is what defines us. So with or without the breast, people will say to me, they're like, oh, well, why would you even want to wear a bra? Well, there could be a bunch of reasons. Maybe you want something soft and gentle against your skin. Maybe you do want your scars to be covered with your sexual partner. Maybe it just helps you feel sexy, and that's okay too. Like, nobody needs to tell you what you need to feel or how you need to feel it. You can just embrace it in, whatever shape, size, and form that comes in for you. So we have many different body types as well with aesthetic flat closure. And then last is by no means something I get in trouble for a lot in this mastectomy space is the breast form. And the whole reason why I created Ana Ono was because I never expected, thought, or saw a reason why somebody needed two breasts if they didn't have them. But it can be an option. It doesn't have to be an everyday. You don't have to wear them all the time. I had a lady yell at me that I was going to give women scoliosis if I told them that it was okay for them not to wear a breast form. And I very politely told her, I don't think that that's how it works. So, this is an option for you. Sometimes you want to dress up. Sometimes you want to wear a dress. You don't have to wear them every day. You don't have to wear them out to the grocery store or to work. It is 100% a choice and an option for people. So, of course, I had to throw the FOOB in there because I see the FOOB as an accessory, something that you may or may not want in your life, and something that is available and simple to wear in the event that it's what you desire. And that's really all that matters. So just to back up with some of the visuals here, and of course, I will open it up for questions and for everybody else. And thank you, Stacy, for bringing such an important topic out to all of us. It's something so special to share, and I'm grateful to have you in my life. And of course, I'll put a code in the chat. If you guys want to shop, we donate 10% to Unite for Her all year long, but in the month of October, we are making 20% donations. So I will put a little quick link in there for you guys. If you want to buy a bra, you'll get a bra free with this code. So be sure to check that out, and please just email or message me if you have any questions.
Oh, you're the best, Dana. Thank you. Thank you for being so kind to our community as well, because they love what you stand for, and it really is a community. You have given so many of us agency, and I do want to say us. I remember walking in and meeting you for the first time and told you that I haven't worn a bra for 13 years, and you
True
you
story.
said, why?
I remember that event as
And
well.
I just was like, yeah. And you turned me around, right? To feel that sexuality again. And, I had trouble. I waited 4.5 years. I got reconstruction. They capsulated, had to get them removed, try it again. It's not easy. It's not easy. And you think of all those choices that we make. And I feel like you were the first one that made me feel like, oh, I'm back. Like I feel like I can look in the mirror again. And I didn't feel that way. I just did not feel that way for so many years. So thank
Sometimes
you
you
for
don't know
everything
what's
you do.
missing until you find it. And,
Yeah.
you know, it's these little pieces of these breadcrumbs that get placed throughout our lives. And then you say, oh, maybe that was a little, mine's my eyebrows. I didn't draw them on tonight, but
Mhm.
you know.
Yeah, I know. It is interesting, right?
Mhm.
Yeah. And I just love that you allow everybody to approach what makes them feel beautiful and then showcase it and take photographs and be on the New York runway as well at Fashion Week. I love it all. So thank you for making everyone feel so seen and valued. Oh, Jennifer just took the words right out of my mouth.
Oh,
Look at
love
you, Jennifer.
that.
Oh, I love it. I love it. Yeah, it's so good. So I thought maybe we bring everybody on again, Erin, just to open it up. We have a small enough group that I feel like people could unmute and ask some questions if they would like. Clearly, Dr. Nazarian is in surgery, so we don't want to feel like, we have to wait or hold anyone out, but we have such an amazing panel. So if anyone has any questions, Dana, I see that there's one here. Is there some kind of wrap around piece instead of a bra with straps?
Yeah, I can say the biggest complaint that we hear from aesthetic flat closure individuals is that, you know, a lot of times things can slip and slide and move around. So we have a few bras that are designed specifically to lay flat on the body. Our most popular is the Leslie. So it's going to have straps, so it's not going to twist and turn, you know, as it's sitting up against your chest wall. It's also going to be really soft and gentle. Something that we hear a lot is when you bend over with a blouse, being able to kind of just have something gently against your skin, so people aren't really necessarily seeing down. And then we also have the Maggie, which is a lacy style that sits completely flat against the body too. Um, we've heard some complaints with the tube tops that they can slide around your waist or they can twist and turn, and then it doesn't give you a good experience throughout the day. So that's why the straps are a little beneficial. But if I do see anything, Susan, I will let you know, because there are always more things that we can design and help support you all with.
Yeah, Dana, I wanted to jump in only because I love that you have the new prosthetic that you're using, and it looks like it reminds me of the cake cups in a way, like those cake cups that all the young girls have, and I love them actually because my reconstruction still isn't quite right. But do they adhere as well?
We don't have any self-adherence ones, but
Okay.
there are other forms on the market. We love the True Life custom breast form. Again, happy to follow up with you guys with some information. I just want to be clear too, all of these garments that are carried at Ana Ono and in stores like JN are covered by your health insurance.
So
So if
good.
you are not aware of that coverage, please
Yeah.
message me. I am happy to send you guys our frequently asked questions and a guide on how to do that. Custom breast forms are a scanning process that goes against your chest wall. So if you don't have aesthetic flat closure and you've only had a mastectomy and you maybe have some skin or some divots, that breast form will actually conform to your chest wall. So it's a nice and smooth surface. There are self-adhesive versions. There are ones that fit into pockets. Again, all of these are covered by your health insurance. So make sure that you look up either a local durable medical equipment store or a mastectomy boutique. They will be able to run your benefits. And then at Ana Ono, we have HSA and FSA, but you can also submit your insurance to, or your receipt to insurance for reimbursement as well. Hopefully you don't have to pay for these things. You shouldn't have to. The coverage is meant for a lifetime. Most people can get up to like 4 to 6 bras a year and about 1 to 2 breast forms every 6 to 12
Great.
months.
Great. Yeah, it looks like I'm going to stay with you if that's okay, Dana. It looks like Jennifer was asking a little bit about the breast forms, the extra padding. She right now is aesthetically flat, and she just feels like that would be helpful right now if there's a little bit of padding in there. Do you have any recommendations?
Yeah, so we hear this actually quite a lot because not everybody's aesthetic flat closure is a smooth chest wall. We can see divots that kind of come into the chest wall, right? Where you might have a little bit divot at your scar. That's really your rib cage. And then what will happen is your tummy tissue will start to come out from that rib area as well. So we often hear, even when you are flat, we have a few different options. We have like insert pads that kind of just help give you that more flat wall rather than seeing like an internal divot. And we also have very small breast forms. Sue had kind of mentioned to them earlier. They're really a lightweight silicone. They're super duper light. They're clear. You can also put that in the pocket of the bra, and then underneath your clothing, it just sort of shields some of those divots and some of those that unevenness that can present itself on your chest wall. And again, they might not be for every day, but they might be for a special occasion, or maybe you're going to an event, you're wearing a silky top. I know for me, my reconstruction, Sue mentioned this as well, is very flat. I have a very flat projection. So I tend to wear very oversized blouses and things that can hide these imperfections because I see them. And so, if that just gives you a little bit of a boost of confidence to throw it in or to wear it, it's perfectly fine. And it's really easy to adapt to different styles.
Yeah, Dana and Sabitha, I feel like you were the same timing as me, but at the time when they were just giving us our options, the
Right.
doctors were doing the tattooing and they just looked like they were just like red dots. Like it was so bad.
Red circles.
It was so bad. And I'm like, yeah, I'm good. Nope, I'm not going to do anything.
Nope.
And then came Mandy and three-dimensional tattooing. And can I tell you this 3D tattooing, like 10 years later, I was 10 years out when I finally got them, that it took my eye away from the scarring to that tattooing.
Yeah.
And it really was, again, this next level of allowing us to make these choices of what we want for our bodies. And I feel like I just love seeing the agency that the women have when they tattoo and just make beautiful artwork all around their chest. So
And I think mastectomy tattoos are really incredible. They have come light years.
light
There's
years.
a lot of
Mhm.
organization.
Yeah.
P. Inc. Is a great one, Empower Inc. And I think what these organizations have done is I will say, if you are looking at a mastectomy tattoo, if you have a flat chest wall, the most important question is to ask your surgeon. And the reason why you're asking your surgeon is because you want to understand the thickness of your skin. Sometimes, depending on your mastectomy surgery, the skin can be left very, very thin. And that's going to be up against your bones and your rib structure and maybe a little bit of your pectoral muscle. Another thing is radiation damage. If you have undergone radiation damage, that might also affect the sort of surface area of your skin. So asking your doctor first, am I in a safe place to investigate a mastectomy tattoo? Then, as you look to tattoo artists, really make sure that they have done it before. There are now thousands upon thousands of tattoo artists across the United States that are doing beautiful and incredible work. So you really do want somebody with experience that understands the skin sensitivities. You might not have any feeling there, depending on how your surgery went. I don't have any feeling, but you might not have any
I
feeling,
don't
but you
either.
might have it up around your collarbone, into your rib cage, and into your belly. So being conscious of that as you're thinking about your designs and the execution of it. But now with so much inspiration online, you can really, I think, come out with an incredible result. I love mine. It is one of my proudest pieces on my body, and I think it just really helped
Oh, no.
bring the picture together.
It's so good. It's exactly what Kim said. She loves hers. She just feels like it reclaimed, that control and that's what tonight's all about, right?
Yep. And reclaiming your body, with tattoo or with a lacy bra or, anything that makes you feel sexy, go for it.
Amen.
Mhm. Mm.
I
Yeah.
will I will say, for me, and again, I'm a different, right? I didn't have a lot of choice in how I ended up, but since then I have experienced different bras are uncomfortable or I have pain in a certain area, I guess, and I was never none of what you just said, Dana, was explained to me. Having a really good physical therapist and going there and having them say, okay, this is normal. This might be your bra might be what's causing this pain under your arm when you think my cancer's back. It's in a lymph node under my arm on my cancer side. So I think it's really important that women are aware and whatever brings you to this place and looking at everything that Ana Ono has to offer, whether it's for comfort, whether it's to make you feel sexy, something more lacy, whatever that is, because I've been through it all. And I would go back to what Dr. Friedman said about, feeling comfortable with your partner. Again, I wasn't given a choice and I felt so ugly and I wanted to keep a shirt on all the time. And my husband was so supportive and he still is, but it took me a while to get there. So I hope that women take away from this conversation again that there's so many options. And even if you're put in a position like me where you're not necessarily given all those options, that there's options after the fact and that you can find what makes you feel good about yourself. And for me, it's been a little bit of everything. I haven't done any tattoos in that area yet. I probably should because I don't have any feeling either. So I could just, get something very intricate, I'm sure. But yeah, it's, there's options there and your insurance covers them and everything else. So definitely.
Even though, people talk about lack of sensation, you know, it, it- sex is more in your brain. I mean, sex, your erotic feelings, thoughts, fantasies in your brain. So we can sexualize parts of our body that do not have sensation. I know this may not sound like a plausible thing, but it is true because we can fantasize about our bodies in different ways. I have no sensation in my breast, haven't had it for the entire time, but there are ways to, kind of eroticize our bodies with our own fantasies because, sexual feelings, thoughts are created in your brain. So that's
Yeah.
definitely the option we have to give ourselves.
Yeah. Thank you. Well, I'm going to open it up if anybody wanted to add anything else in the chat. Erin, I feel like I see one there with Jennifer.
Yeah, she makes a really good sort of
Yeah.
analogy in her life. She equates her scars to her scars of pregnancy and birthing, which she feels really proud and powerful for. And I think that's a really great perspective reminder. Yeah, it makes it feels incredibly sexy to her. So I love that.
I do too, Jennifer. It took me a while to get there, and I'm so glad I am there. I'm 21 years out, but to now look and just feel so like they are my body. I'm so proud of my body and what it went through and what it came out on the other side and what it can do now at 61 years old. And oh, I'm so proud of it, right? And to have that perspective, it just takes away all of that, trauma, because it is trauma. We have to give that to ourselves. We have to know that it is a
Mhm.
trauma and we have to go through those, feelings, but to be able to come out on the other side and be, look at that in a different way, you can feel really, really proud. So
Mhm.
yeah, thank you,
Mhm.
Jennifer. That's so good.
And I
Mhm.
will say, just listening to all of you, and the common theme that I hear, which I'm sure may resonate with a lot of others, is that these feelings of where you all are now and how you got here, it took time. And I think understanding that this isn't something that happens overnight, and just reminding those that are with us this evening that perhaps you don't feel like you're where our panel is tonight, it doesn't mean you will not inevitably get there. And certainly working with professionals like Dr. Friedman or someone in your area that can help you get there. I think it's reassuring as I listen to all of you that you can get there and you can feel empowered and you can feel beautiful and sexy in this body that you have. So I think just hearing that reminder from all of you is reassuring.
Yeah. And there's a whole
Yes,
community out
great message. It's a great message, Aaron.
there. Yeah,
Thank you
for
for that.
sure. Yeah.
And
Well,
I
Erin,
have
I
to
couldn't
second.
think of
Oh,
a better way to, have our October speaker series. Yeah, share with our community. It was
That's
such a
it.
good night. Thank you all for coming and joining us and giving us all of your perspectives. And always love listening to each and every one of you, and to our community for coming out and being, open to the conversation and giving us feedback. And please continue to share different ideas that you want to hear on our speaker series, our Ask the Experts, our virtual hangout. We really are here absolutely for you. You are our why. We are serving over 10,000 a year now and very humbled by it. And we continue to grow and continue to work for you, our community. So please let us know. Erin and I are very open to what topic would be really informative for you. Yeah.
Absolutely.
Dana,
Well, thank you so much. Yeah, thank you so much for our entire panel this evening.
Thank you.
Thank you.
you're welcome.
Oh, the best.
Yeah, it is the best.
And we'll be sure to tell Dr. Nazarian we missed her, but she's doing
Yeah.
incredible work. She
know.
is doing incredible work this evening. So we're happy to have her next week, and I'm sure we'll have her back again to share so much more to get into with this topic.
Agree. All right, Erin, another wonderful speaker series, and I know that the recording will be there in our library. So if anybody missed it that you know of, you can always tell them to go to the library because I know we have a close community. And again, thank you for everything that our sponsors do so that we can bring events like this and have this very robust panel with us. So a huge shout out to our presenting sponsors, West, Merck, Lilly, Gilead, and Novartis. And then our gold sponsors, GSK, Pfizer, Daiichi Sankyo, with supporting sponsors from TerraSera and AbbVie. We do well over 60 of these a year with our workshops and our cooking webinars, and we've just created this whole community. So we appreciate just the ability to be here and talk to you and bring this information front and center.
Absolutely. Yep. And don't forget, this is just the first of many great events that we have coming to you in the month of October. So hopefully I will see many of you on Wednesday or share that segment with those that it may resonate with. So October 8th, 5 p.m. Eastern, we're all talking about keeping your crown. So we'll be joined by a representative from Paxman Scalp Cooling, as well as a representative from Cold Capping Partners of America, talking all about how to preserve your hair during cancer treatment. So we know, just like this evening, that is an important discussion and there are options available. So really, really happy to be able to dive into what is available to the cancer community. In addition, we have a speaker series next week again, Thursday, the 16th at 6 p.m. And we will be diving into, we will have Dr. Nazarian next week, surgical insights and patient perspectives on male breast cancer. So we'll be joined by amazing surgeon as well as Unite for Her member sharing his story as well. So really, really thrilled and honored to have both of those discussions as well as our truly incredible panel of experts and the patient perspective with us to kick off the month of October. So all of which will be available at uniteforher.org/UFH Connect.
Yeah. All right. Take advantage of those wonderful coupons from Anna Ono.
Oh, absolutely.
Very good to our community. Erin has been for years, but we have a little extra in October. So
Little extra. Yeah.
love
Dana's
seeing-
amazing.
I love seeing everything just change as far as just her line, and she grows with the community so beautifully. Yeah.
Yeah. And I will say, I learned also this evening, she has products for male breast cancer as well. So she truly continues to expand and be thoughtful to represent all of those that may be diagnosed. So we really are grateful to her for really making the waves.
Yeah. Agree. All right, everybody, have a wonderful evening. Thank you for joining us this Monday. And we hope, we get to see you again in our next speaker series and Ask the Expert.
Wonderful. Good
Everybody.
night, everyone.